Joint replacement, something a lot more people are doing, but what is it and how do you really know if you need one? Dr. Gage Trott with ProMedica is here so we can learn more about it. Thanks for coming in, Gage. So you, for all of us former jocks, current jocks, wannabe jocks,
yep,
we come to you to fix this up when we really met what our body says, nada.
Correct. So joint replacements procedures is kind of the big thing that we're going to be talking about here today. And what that really entails is a surgical procedure where we will go in and remove areas of damage inside your joint. That's bone, that's bad cartilage, which is the cushion inside the joint space. And we replace that with things like metal, ceramics, or even what's called polyethylene, which is a medical grade plastic, to recreate the joint mechanics and hopefully allow us to have a better gliding and sliding in the joint space to help the symptoms improve.
Now, knees and hips are the one probably most people are familiar with.
Yep.
Are those probably numbers-wise the one you deal with the most?
Correct. Knee replacements are definitely the most common. Most recent literature over probably the last couple of years, almost 800,000 knee replacements every year in the United States. Hip replacements second most common, approximately 500 to 550,000. Shoulder replacements being the third most common, right around 50,000. But there are a couple other kind of oddball ones as well. This includes elbow replacements, ankle replacements, even some small replacements in hands and fingers that can be done as well for certain patients.
Now, a lot of times really could be a bad car accident would mean needing that, not just athletic injuries, the whole thing, but just now it's a lifesaver. You can still resume a normal life with an ankle replacement, something like that.
Correct. So the most common, the classic reason people get replacements is what's called osteoarthritis, which is just degenerative joint disease. That's when the cartilage in the joint thins out from overuse or wear and tear. But there is a separate subset, like you mentioned, which is post-traumatic arthritis, which can be from fractures, it can be from ligament injuries, it can be from a variety of things that have happened across the time frame that lead to early deterioration of your joint, then seeing some of the symptoms that then come about, and then may require things like a replacement of your joint.
Doctor, if someone's watching this and thinking, man, yeah, my knee has been bad or my hip's been bad, you got to go to a doctor. First of all, get checked out and have them look at it and have an expert look at it. But like typically, what's a tipping point of trying to rehab a joint that's really tired and replacing it?
My biggest, I think, cutoff for most people, and the thing that people tell me the most when they come in the office, is that sooner or later it just starts to affect their normal everyday life. Yep. It's their ability to walk, their ability to sleep comfortably, their ability to do the things like to do either leisure activities or work. And once it starts kind of really starting to inhibit some of those things, that's when people oftentimes are making that next step to be evaluated. Surgery is obviously kind of the end all. That's kind of the top of the mountaintop, but there's also a lot of non-surgical things that we can be considered in the early phases, things like physical therapy, braces, topical treatments, anti-inflammatory medications even, or even things like injection-based treatments. That's things like steroid medications or other things like hyaluronic acid or stem cells or PRP. These are some things that people can try in the early phases. Once all that stuff fails, though, that's when we really start having a pretty candid discussion about maybe surgery is the best option for you as the next step. It's
stunning that a lot of these surgeries are outpatient. I mean, you're not in the hospital that long, and if you're thinking maybe I need a hip or a knee, it's really changed light years in the last 5 years, 10 years, 15 years. Talk about the rehabbing through that.
Yeah, so I think one of the common misconceptions people have from the historical process of replacements was that I may be in bed for multiple days, I might be in the hospital for 3 to 5 days. That's really not the case anymore.
And my pain tolerance.
And that's really not the case anymore.
Yeah.
Nowadays, for low-risk patients, it can sometimes be a same-day or outpatient surgery. So you come into the hospital, you have your surgical procedure. You work with a therapist in the post-operative area to make sure you're safe getting around and things are going well. As long as you pass some of those things, we're able to get you home with outpatient physical therapy and home physical therapy while we slowly start to recover from those procedures. But most people, especially for hip and knee replacements, they're walking the same day. We have you up and moving. We have you walking with assistance like walkers and canes and things like that, so we're doing it safely. But the reality of it is nowadays we are able to get people up and moving very, very quickly, and it's not that same kind of prolonged period of time in terms of the rehab that's required in terms of being stuck in bed.
Got about 30 seconds left. What are common misconceptions about getting a joint replacement?
One of the common ones is, I think, the downtime that's revolved around it. So one of the couple other things I always talk about with patients. Number one is people sometimes come and tell me, hey, Age, I'm too old for a replacement. And that's not always the case. I oftentimes rely on other things like your medical comorbidities, diabetes, heart disease, things like that are much more important to me than sometimes the age is in terms of having a replacement. As well as there are some things that when you have a replacement done, there may be some slight alterations to your normal anatomy. It might not feel exactly the same as when you had your native joint before that. But honestly, across the board, people do quite well. The success rates for these surgeries are very, very high, and people generally are quite happy with the results that they get after these types of procedures, even with some of those mild limitations.
You're good. Really enjoyed talking to you. I could talk to you another 10 minutes on that. Dr.
I appreciate
Gage
you
Trott.
having me.
Thanks
Thank you
so
very
much.
much.
Appreciate it.